Hello everybody, this is Sharon Parlia, your instructor, and today we're going to talk about information technology. This is course T2060, Fundamentals of Health Informatics, and this is Module 2, Information Technology. So, let's get started. First, I'd like to give you an overview of what we're going to talk about today in this module. Today we're going to talk about what is information services, what is an IS department, what's the size and shape. They come in all different sizes and shapes, as you can imagine. Then there's a lot of terms, and what do they all mean? For instance, full life cycle, applications, outsourcing, whether it's onshore, offshore, interoperability, and finally analytics, also known as a method of reporting. So IS, what does it mean? You'll see a lot of acronyms thrown around, and it becomes almost like an alphabet soup sometimes. But let's look into each one and see what in fact they each mean. So IS. IS stands for either information services or information systems. These two terms are interchangeable for the most part. MIS, another term you'll see as a MIS department, is Managed Information Services. DP, or data processing, again, just another term. Sometimes you see it as an IT department, sometimes it's an IS department. IT now stands for Information Technology. HIT, which is now becoming more prevalent, is Health Information Technology. Then there's different roles people play within an IT department or are affiliated with an IT department. For instance, a CIO, a Chief Information Officer. They usually fall under the C-suite of a hospital, the CEO, the Chief Executive Officer, or the COO, the Chief Operating Officer. You'll often see a CIO, who is usually the chief person in an IT department, sit on the same level as those other C-suite type people. CMIO, this is relatively a new role, of course, with the implementations of EMRs lately, and that's the Chief Medical Information Officer. We now have much more medical presence and affiliations with the IT department. So you'll often see a physician either actively working in the hospital or now taking a separate role as the Chief Medical Information Officer, really a liaison to the IT department. And then an SME, or also called a SME, is a subject matter expert. That's a person who's really an expert in either the application they're working on or usually the application. So again, an information services, by definition, is a service provided to one or more customers by an IT service provider. It's a service-based department usually. An IT service is based on the use of information technology and supports the customers, the end users, business processes. An IT service is made up from a combination of people, processes, and technology, be it software and hardware, and should be defined in a service level agreement, or an SLA. And once again, there's a lot of terms within the information technology world, so let's just go through a few of them now. General Office of Information Technology. This often includes where people work on the internet, the intranet. That's often like an inside application within an organization that acts similarly to an internet. Email, security, desktop servers, printers, applications, such as online calendar, Microsoft Office, GroupWise, any of those type applications. Next, an electronic health record system. With that type of system, any EMR, you need hardware, software, network, interfaces, to outside maybe labs and other regulatory agencies, and input devices, such as a handheld scanner or a signature pad. Other applications, which fall under IT as well, are many of the financial and clinical applications, such as billing, accounting, ancillary applications, such as a lab, dietary, radiology. All of these ancillary applications now are either incorporated within an EMR or have their own very specific type software package. Business intelligence, data mining, patient registration and demographics, done, either upon scheduling or upon admission to a hospital, an ER, or a doctor's office. Other technology that also falls under information technology would be a PAC system, handheld devices, a Pyxis system, robots, IV pumps, and some of these we will be covering in other modules within this course. Like I said earlier, IS departments come in all different sizes and shapes. How information services is shaped and sized depends on the size and complexity of the organization and its technology. There are large hospital systems that often have several hundred IT employees. A community hospital usually has a staff of approximately 50 to 100, depending on the size. Physician practices can have maybe 1 or 2 IT knowledgeable staff members or super users. Now let's talk about the parts of an IT department. Sounds like a puzzle, doesn't it? Sometimes it feels like a puzzle. So it's often broken up into different areas, all reporting usually up to a CIO. So there's a service desk or help desk. This is where the customers have access to the IT department. These are where your help desk calls come in. They manage and support incidents, problems, and communications. It's often like a triage area. Change management is how to document changes in an existing system. We can't just go changing things without everyone knowing. And within IT, because of the makeup of it, it's done very particularly. Each change is done in each environment. It's communicated out. It's documented, and there's a process involved. Next, user communication. Managing user communication and involvement. Committees, meetings, acting as a liaison, communication plans, project plans, being a committee representation, as well as education and training. The CMIO, as I mentioned, the CIO, there's also project managers, analysts, and often consultants. All of these in total are usually what make up an IT department. Full life cycle. What does that mean? Well, it means from conception through development, from procurement, purchasing, to dismantlement. It's the entire life cycle of any project. It includes implementation, security, interoperability, specific application or set of related applications, such as a radiology system, often called an RIS system, or a lab system. There's many pieces of it. So putting it all together, that's what full life cycle is. Also includes project management. There's project plans, there's teams, there's sometimes PMO, project management office is involved as well. IT applications. As I mentioned before, in a hospital or a doctor's office, IT applications usually fall under 2 umbrellas, either financial or clinical. Let me talk about each one of those. So financial applications and also administrative applications would also fall under this umbrella. Would include such items such as billing, accounting, registration, human resources, procurement and inventory, also purchasing, payroll, as well as medical records. Clinical applications, on the other hand, include what we've been discussing, such as an EMR, clinical documentation, a laboratory system, LIS, radiology, including the RIS system and a PAC system, pharmacy, the emergency department, dietary, surgery. All of these ancillary applications have their own either software or their own section within a big software package that has an EMR as well. Outsourcing. What's that all about? As I mentioned before, outsourcing also comes into play in the world of information systems. Hiring another company or companies to provide some or all of your IT services. And this could be done on an on-demand basis, sometimes a small doctor's office, or even at a hospital. They have a go-live happening. They just need consultants to come in for, on demand. Sometimes it's ongoing. Sometimes it's more cost-effective to hire an outside company and have them take care of all the IT support and services that are needed. Sometimes it's just they outsource the help desk, but this is an ongoing operation. Then there's different types of outsourcing. You can have outsourcing on site. I myself have worked for companies that have done that, or remote. You can have consultants can be anywhere. One job I had my whole team was virtual, and they were in India, and I was in New York. So, like I said, it could be blended, on-site and offshore, or it could be, one or the other. And then again, like I had also mentioned, there's selective outsourcing. You can outsource your data center. You can outsource just the help desk. You can outsource certain applications. There's many ways this can work, and I've seen it work very successfully as well. Interoperability, or in other words, sharing of information. Electronic sharing of information between systems, departments, people, and organizations. It's also called data integration, interfaces, health information exchange. You'll see a lot of these terms within the healthcare IT world. Personnel. There are specialists that just work in health information exchange. Other related areas are enterprise master patient indexes. This is when you have a patient medical record number that carries with them throughout a whole organization, or within a multi-hospital or multi-facility organization, as well as terminology services. Lastly, let's talk about analytics. It's another buzzword we've seen in the industry lately. So what is analytics? Analytics are tools for analyzing data you have collected for clinical and administrative purposes to derive and present knowledge. What are some of the reasons for analytics? Well, performance improvement, quality, safety, reporting, research, the list goes on and on. These have all been enhanced by having analytics available. We want to find the answers. There are mining and repository applications available just for that purpose. We want to be able to present the answers. There's presentation applications, reporting tools, web portals. It's important to be able to report out any information that you've been able to collect. This concludes Module 2, Information Technology. I hope you enjoyed it, and I look forward to seeing you all in Module 3.